Hello, hello, everybody. Welcome to Women in Midlife. Anyone knows about visceral manipulation? Well, today I have an expert who will be talking to us about how we can use this method to ease pain, especially common pains that most women over 50 that are going through menopause can have find comfort and without taking unnecessary medication and using manipulation to ease some pain. So don't go away, and we'll be bringing an expert to talk. And if any questions, please leave some comments below, and I'll surely address them. And see you soon. Hi, everybody. Welcome to Women in Midlife. As you can see here, we have a young man. His name is Alvin, and he is representing VL Therapy, and he's a qualified physiotherapist specializing in visceral manipulation. Am I right, Alvin?
Yes.
Yes.
So I'm a physiotherapist. Hi, everyone.
Hi. So tell us a little bit and educate us what is visceral manipulation?
Sure, Karen. Yeah. Hi, everyone. I'm just gonna quick introduction of myself. So I'm Alvin. I'm a physiotherapist. So like what Karen have said just now. So yes. So we actually practice visceral manipulations in our practice in our clinic as well. So I think not many people actually heard of visceral manipulations because it's quite new in Malaysia, especially. Okay. So previously, I was working in a hospital, for the past uh, quite a number of years. Okay, and then after that, 2017, I started my own company, and then that's when I found out about visceral manipulations. So visceral is actually organs. Okay, that's the term, another terms for organs. Okay, so we actually help patients to treat the pain, like let's say back pain or shoulder pain, by treating the organs because 80%, 90% of the time is actually because of the internal part, okay, the organs, the nerve, blood vessels that is actually causing us to have all these issues. So because not many people know about it, so people thought like, oh, when we are doing visceral manipulation, right, people think that we are doing some voodoo stuff.
Yeah.
But we are not. Yes. So visceral help in of course pain, and now of course it will help with your posture.
Okay.
Even like let's say constipation, bloating stomach, headaches. Yeah, so we can also use visceral manipulations to help with our patients in the treatment session as well.
Okay, because that is super important because as you know, my channel reflects, I mean, our audience is generally women over 50. And yes, and menopause is a big pain on the butt for us because we have a host of problems that pops up. Bloatedness, constipation, and frozen shoulder, as well as plantar fasciitis, which is very common because of inflammation and things like that. So how can this manipulation assist us, and how long generally a treatment will take? Let's say if I'm just at the onset, I haven't gone a full-blown problem yet, but it's just onset. How long will it take, and what's the process like?
Yeah, so I mean, is it for plantar fasciitis or what is it?
Let's say frozen shoulder.
Frozen shoulder, sure. Yeah, so I mean, yes, I mean, frozen shoulder is one of very common condition that some people will have, especially above 40s and above. Okay, so it start to develop, and actually research actually says that there's no definite answer.
Okay.
They can't find out what is the real cause for that.
Right.
Okay, so when you come in, with a frozen shoulder, normally we will do an assessment, which is very important. Okay, because how the frozen shoulder affects you, okay, and how it affects me can be different.
Correct.
That's one. And then the activities that we do, the lifestyle that we have,
Okay.
they are both different as well.
Right.
Yes, so that's why we need to take into all these into considerations. Then we can also provide better educations and exercises as well.
Right.
So, like I say, assessment is very important. So we'll do assessment first to find out what is actually causing the frozen shoulder.
Okay.
That's one, yes. Because like let's say spleen, stomach on your left side, it can actually cause shoulder pain. Okay. And on the right side will be the liver. It can also cause shoulder pain as well, besides from back pain.
Right. Okay.
Yeah. Yes. So besides from the joint as well, of course. I mean, frozen shoulder. That's another name for it. It's called adhesive capsulitis.
Okay.
So, like the name, adhesive capsulitis. Adhesive, that's mean adhesion like gluing.
Okay.
Capsulitis, that's mean the inflammation of the capsule.
Right.
Yes. So when the capsule, that's mean the shoulder joint is all glue. So it's very hard for you to move. That's why. Yes. So that's why sometimes you will see some people who have like frozen shoulder. It's very difficult for them to lift up their shoulder.
Yes. Yes. Correct.
Yes. So of course there are 3 stages. So it depends on which stage is the patient. Yes. Then of course we will work accordingly. And then all of our technique is actually by hands-on. So that means we use manual therapy all by hands.
So there's no machines to assist with that, and it's just using your hands. And do you put some oil for easier?
It depends. I mean, we don't normally use oil. Okay, like for myself, I sometimes use lotion. Okay, just a normal lotion. If let's say I were to do some like a myofascial release on the tendon or the muscle, okay, that would be easier just for lubrication purpose. It's not to like there's no medications in the lotion.
Okay.
Yeah.
And generally a session will take, I suppose, 45 minutes to an hour, depending. Is that right?
Yes, so that's the normal session, like 45 to an hour. But sometimes we have, like for myself, I have patients that after 30 minutes, I'm done with the patient. Okay. To be honest. Yeah. So that's why it really depends on the condition itself.
Of course.
Okay.
Yeah.
And frozen shoulder, it can take quite a number of sessions. Okay. To recover.
Okay.
Yeah. So like the one I had. The longest I had, I think it took me about like 20 plus sessions to help the patient to recover.
Okay.
Yes.
Is that dependent on how soon the person comes in and gets help, or if they have left it unattended for too long? Is that it definitely take a longer time, isn't it?
Yes, of course. That's why prevention is better than cure. Correct. Once you have some uncomfortable feeling or abnormal sensations,
right.
Wherever it is, your shoulder, your back, your knees, it's better to get checked, okay? Because the sooner you go and get yourself checked and get treated, of course, the recovery rate will be better, will be faster, compared to if let's say you drag for 3 months, 1 year, then only you go and see physio, chiropractor, then of course the condition may take a while to resolve.
Yeah, definitely.
Yes.
Do you think that to advise the audience, is it something that maybe they should prepare mentally that it takes a lot longer to heal, because it's basically the visceral manipulation is something that's very natural and is allowing your body to heal naturally, isn't it? There's no medication involved. Am I right to say that it's not a substitute for doctor's advice as well? Am I right?
Yeah, that's a very good question, Karen. Yes, I mean because we are doing manual therapy, just hands-on, right? So when we manipulate the organs or the nerve, or the muscles, I always tell my patients that we are just facilitator, okay?
Yeah.
We are just helping the body to do their job. We are just kind of urge the body, or telling the body, hey, liver, can you work a little bit more? Yes. So then, of course, it will work by itself. Okay. And then you do the healing.
Right.
But one thing that we need to take note is that the lifestyle that we have. Yes. Again, are you doing exercises?
Right.
The diet.
Right.
The sleep.
Correct. Yeah.
Yes. And etc. There are a few things that we need to take into account. So if let's say after the treatment, if let's say you were to go for a drink, alcohol, okay, then of course alcohol can cause inflammation. So after the session, we try to reduce the inflammation, and then you drink the alcohol,
Right.
and then of course it will increase the inflammation again.
Of
Then you
course.
feel that the session is not working.
Right. Yeah. Exactly.
Yeah.
I mean that we have to help ourselves, isn't it, and our body.
Yes.
Yeah. Because
Yes.
I did a session about how important the food we eat helps us in healing, and even cancer patients, stage 4, stage 5, or whatever it is, they actually reverse due to just the food. So would you dare to say that if somebody comes in with maybe a let's say cancer, that with your manipulation, with diet, that the quality of life for somebody can actually improve tremendously?
Okay, we can't guarantee that we can reverse the condition. That's very important. Okay,
Yeah.
Even like let's say diabetes patient or kidney failure patient, we can't exactly reverse it.
Of
Okay, we
course.
can't guarantee that.
Of
Okay,
course.
although there are certain cases, we manage to.
Oh.
Okay, yeah, like diabetes, not cancer.
Right. Yeah. Yeah.
Not cancer.
Right.
Okay, yeah, so we are able to help.
Oh. Okay.
Yes, even like sometimes they have like let's say I have a patient who was having kidney failure, was causing the back pain and also the knee pain,
Alright.
the leg pain. So I told him, I can't reverse the condition,
All right.
okay, because the kidney, it was how to say, we call it frozen.
Okay.
Okay, that means it's not moving. By right, we have motility in our organs. I mean, our organs have movement. Okay, they call it motility. Okay, it should move. Okay, but what happens if let's say it doesn't move anymore? Just like our hands. Okay, if let's say it doesn't move, we can't turn it. Yes, it's dysfunction. I have to compensate to
Right.
move my hand.
Right.
Right. Same thing for the organs as well. So that's why we just use the manipulations to help with the patient. And then the following section, when I check on him, somehow the kidney start to move a little bit better.
Oh.
Yes, and then the condition is also the pain and the back pain and the leg pain is also slightly bit better as well.
Wow. Okay.
Yes,
He
so
must
we
be
can
really
actually
grateful.
reduce the symptoms that the patient have.
Yeah.
Although we don't guarantee, we can reverse the condition.
Of course not. Of course not. I don't
Yes.
think even doctors dare to guarantee anything.
Yeah.
Because the body functions differently, isn't it?
Yes,
So,
that's very true.
so in terms of in our modern technology, we kind of hunched over. We are always looking at the computer with the laptops and the phone. So the neck and shoulder is something that is very common. Would you give us a little advice to all our audience as to what are the simplest things that we can do at home to help with the stretching and relief of this problem that we have?
Sure, Karen. Yeah. So yes, I mean, my patient is also having a neck pain issue. All these modern technologies. Yeah. So one of my favorites exercises, and it's also the simplest, which is it can. Okay. So this is my left hand. Okay. So you can put it at the back. Okay. Or maybe you hold it onto your chair. Also possible.
Okay.
Yeah. And then my right hand, I'm gonna hold my neck. My neck is gonna tilt to my right hand. Yes,
Oh, I
and
feel
then
a
you
crack.
feel some pull on this left side of the neck.
Right.
Yes, so you can hold for 10 seconds, 20 seconds, 30 seconds.
Okay.
Yeah, after that you can switch to the opposite side. So right hand at the back, and then left hand hold the neck, and then again you feel the stretch.
Oh, yeah, right. It's so nice and pulling, but I feel a crack as well.
Yes. Yeah, so you just hold it, for 10 to 30 seconds. Okay.
Right.
So in a sense, the duration you can play with it. Okay, the numbers you can play with it. Okay. Yeah. So it's one of the easiest exercise you can do. For the neck. Then you can also do a chin tuck. Yeah,
tuck?
just
Just like
chin
that? Oh,
tuck,
the
yeah.
ugly chin tuck. Okay.
Yeah, the ugly tuck. Yes, you just your chin. So if I say I just do a sideways,
Right.
I just so you can see my finger on my chin, and then I just
Oh,
just away from my finger.
okay.
I'm not moving my finger, but I'm just moving my neck.
Yeah, but I can feel the relief. Like the back is being stretched, extensions.
Yeah, because most of the time we'll be
Doing
looking
this.
down.
Yeah.
Yes,
Yeah.
you know, protrude the neck. You know, so
Yeah.
that's why we trying to reverse that to bring it backward.
Okay. Cool.
Yes.
That's
Yeah. So you can do it.
that's worth a lot of money already to the audience, just knowing a simple thing like that, right?
Yeah.
But okay, so tell us about what you have offered for our audience with from VL therapy.
Sure. I mean, you know, especially for you, okay, Karen, okay.
Thank you, thank you.
So, like, you know, to the audience, yeah. So you guys can use a promo code called Karen WIM10 to enjoy 10% for your next purchase. Okay. Whether it's a treatment session or is it for the package? Okay. And then one more thing, you guys are gonna get a free consultation for the first time.
Wow. Okay. Great.
Yeah. Normally we charge for like $250 for the consultation.
Okay. Did you hear that? Try, people, listen. You're getting this courtesy of Alvin here, and I will post everything down in the description. Please use the promo code, make the appointment, and see this young man, and who will help you feel better, look better, and hopefully enjoy life to the fullest. So thank you so much, Alvin, for your time, and I look forward to more chats with you, and hopefully our audience will come to you for some help soon.
Thank you, Karen, for the invitation. I'm really glad, you know, to able to come to your show.
Thank you.
Thank you.